Okay, and we are recording, Mayra. I would like
Hi.
to welcome to Bloom Health today, Mayra Alba Chartier.
Good
And
morning, Steve.
good morning. Welcome. I see you have a beautiful, beautiful spa there. You know, the Soul Spa. It's so wonderful to see you doing so well and healthy now. And I like the new haircut. Um,
Thank you.
and Mayra has a beautiful journey to expose
Well,
us.
yes, I'm Mayra, and I'm in Pennsylvania, in the vicinity of Bethlehem, only 11 miles from Bethlehem, in Morristown, PA. I do have a halotherapy spa. Are you familiar with halotherapy?
No, well,
It's
just in running down all these things that you do the halotherapy, you do VST, you're part of what, the International Institute for Complementary Therapy members. You're also a member of the SALT Association that you were telling
the
me.
Soul Therapy Association. Yes, they're the leading entity. And I started with putting my business together in 2018.
Wow.
And I opened up in May 5th, 2019. So when the pandemic hit, I was less than a year old on my business. So halotherapy is a modality of breathing pure pharmaceutical salt.
Okay. And what is the medicinal part of it, or what is salt therapy for people who don't know? What does it do, and what is it?
Salt therapy, aka halotherapy. Halo means salt in Greek, and that's why it's called halotherapy. But salt therapy, it is breathing pure salt, dry salt, pharmaceutical salt. How it works is, as you know too, because treating our patient, we actually nebulize salt, normal
Right.
saline, but we do it in the liquid form. So
Air and small
breathing
particles.
nebulizer,
Yeah,
yes.
right.
So the halotherapy is dry salt. Dry salt is super absorbent. How it works is I heat salt, put it in a machine called halo generator. It's a machine about this size, all stainless steel, and the mechanic is very well done. When I put the salt in, the halo generator grinds it in small particles, microns, that it can be deposited in the lower size of the lungs, and therefore it is dispersed into the alveoli, into the lower part of the lungs, and absorb any debris that you have, bacteria, and it help you expectorate, it help you cough out.
What kind of salt do you put in there? What kind of salt is it?
It's pharmaceutical salt, 99.9% pharmaceutical medical grade, is certified by the United States Pharmacopoeia. It's the only one that we put, and it should be put in the halo generator in order for the medicinal effect to take place. Remember, salt out there, the salt, like table salt, is a very different story at the salt that is already being in the lab, that is being approved by the FDA, and is being completely clean, almost 100%, to be breathed and to be beneficial. It works that the salt disperses into the lungs and it binds to the cilia. You know, the cilia is a mechanism that looks like hair. It's in the lungs, and it helps clean up the lungs. That's our cleanup crew in the lungs, the cilia.
Absolutely.
So
It moves along the
yeah, so what happens is it's super absorbent when being dry. Once you get it into the lung with our natural heat in the humidity, then it liquefy and it becomes it becomes like a cleanup.
So
And the cilia can mobilize.
Does it actually absorb out? So what you're saying is that it goes in. So it basically it's cleaning out. It's not bronchodilating, but it's the cilia. It's helping facilitate, meaning to get out secretions. You're saying, and
Yeah. So the mechanism. Yeah. I'm sorry.
No. I was just saying that
Yeah. The mechanism is how it works and help minimize bacterial infection is because when it gets into the lungs with our natural heat, the salt dissolve because the superabsorbent is dissolvent, and it helps liquefy it and mobilize the secretion. Therefore, As you're moving up the secretion and coughing up, your lungs are going to be clearer and open up so you can breathe better and you can absorb the oxygen better.
Okay.
Actually, it's being known and study being proved, although not approved in the FDA, study being done, and it suggests and it shows that it's very good for cystic fibrosis patients and for asthma.
Oh, okay.
I know pulmonologists that refer cystic fibrosis patients to halotherapy.
Wow.
And I have some guests here that have asthma, and we see the improvement.
Now,
I actually have 10 different programs in the Halo Generator that I can adjust according to the needs of my guests.
oh, wow. So so how often does somebody come in? So you're saying it has some antibacterial, anti-inflammatory, but how often would somebody with asthma per se, or any, come to your facility, and how long are the therapies? Like, how long do they last, and how many times should they come a week?
The Salt Therapy Association recommends 3 to 4 a week within 7 days, but of course it need to be tailored to the specific need because everybody's different. Now, in my experience, having some clients here with asthma, they have done twice a week, then minimize like every week, and then every other week until they got better. I have people that have done program of five sections and buy the pack regularly. I have a lady that did a whole program for over a year.
Do you ever incorporate some of your because you are a respiratory therapist as well? Do you ever incorporate any breathing techniques for them while they're in there, or how they should breathe in a different way, or just naturally breathing when they come in?
Absolutely, because breathing is everything. So coaching them how to breathe slowly. The clue is to breathe slowly, deeper, and just normal, but consciously. That way they can absorb better the salt and also relax. I can actually take you to the room and show you the Halo Generator where things take place.
Oh, wow. Yeah, we could do that. Sure, definitely getting shortly. Let's the other question I do have is
Yes.
Also, as you're saying, people who have allergies as well too. You mentioned like asthma allergies sometimes go hand in hand, and then sometimes people who have allergies, asthma, sometimes have eczema. And does this salt therapy also help? So allergies and skin, does it have any medicinal effects for skin?
Fantastic for eczema. I have a testimonial of one of my lady that did it for I think it was about 14 months or so.
Oh, wow.
Almost over a year. Yeah, it would have been 2 years now. And she every week, once a week for eczema, fantastic. It helped with the redness, it helped with the inflammation, and the itchy minimizes. We're seeing the progress, and in the study show the benefits of it. Also for acne, it's also good for athletes because it helps with endurance.
Oh,
As the clearing your lungs, your skin is absorbing. So remember, there's nutrients in salt,
okay.
and the nutrients in salt are found in our bodies.
Mhm.
Sometimes we get deficiency with our everyday life, and as we're getting older, the nutrients decrease in our normal body. So by doing the salt, also you absorbing that, which is natural.
Oh, wow. Do you encourage them to drink a lot of fluids after or before they come into the salt therapy? Is there any kind of
To me, it's a must. To me, it's a must, to the point that I do offer fresh water. I have infused water with natural fruits or natural vegetables, sometimes cucumbers and mint, and I offer a glass of water as soon as they come out of the section. The sections are 45 minutes. So while they in there, they listen to binaural beat, ocean waves, they relax, the light is dimmed, they breathe in the pure salt. When it's done, they come out, they have water. They can have as much water as they wanted. I always have a pitcher of water there, a pitcher. And I also recommend have complimentary tea. And it's very relaxing. People
so is
find it very relaxing when they come over.
Wow, it sounds like, and it's a whole experience to go through, and it sounds so wonderful.
That's my goal, to provide an experience to, when I created this, because my personal experience, I suffer from chronic sinuses. That's how I started halotherapy. That's what I find out halotherapy. I start going to halotherapy once or twice a week. And I was going to work in New Jersey before work. I used to go and do it. Within 6 months, before 6 months, I stopped using my Flonase, which is the spray that you put in your nasals and your nose to help with sinuses.
Sure, sure, yes.
I used to take a Zyrtec pill, which is a pill for allergy also, one daily. I haven't taken that in years.
So you
So
haven't
when I
had,
noticed my progress, I decided that I want to do this for people. Having the background in respiratory, I can help them better.
so now you're off of the Flonase, you're off of the Zysol, you said, which is
The
Levoset.
Zyrtec, yeah.
Oh, Zyrtec,
This
Zyrtec, Zyrtec. Okay, so you're off
no
Zyrtec.
Zyrtec, no Flonase. Oh my goodness, it have to be years,
Okay.
because I started treating my sinuses in 2010, late 2010,
Right.
and by the next spring, it was late summer 2010. I started with the modality of halotherapy.
Mhm.
By when the next spring came in 2011,
Right.
I didn't have the. I just used the Flonase for a little bit. I didn't have to use the Flonase, and ever since, I don't recall using it, or even the Zyrtec.
So how did you get into this? I mean, you didn't just say, "Hey, I want to do this." You had to
Mhm.
research it. And what about other people who are starting who might have the same interest as yourself, or somebody, in another part of the world or country that sees this might be able to do something along the lines that want to help people like you are, and in this aspect? I mean, do they have to, is there a certain organization that you reach out to, you get your materials? What brought you like that? How did you manifest?
Well, I'd be glad. Yeah, I'd be glad to tell you. It turns out that the soul therapy industry being around for hundreds of years, actually in 1843 to be precise. In 1843, there was a doctor in Poland, that on Felix, if I can pronounce the name just a little close, Bukowski. Those of you that speak Polish, just forgive me. But that
Okay.
this doctor in Poland, in Wiliska, Poland, in the 1843, he noticed that in the village, everybody was getting sick, often problems with the lungs. But he noticed that the miners, the salt miners, were not getting as sick, or were not getting sick at all. So starting putting one thing and another together, and he started doing pilot and study with soul caves.
Oh,
Soul cave, just creating soul cave and bringing the soul concept into the cave. Now, bringing to modern day, in Russia in the 1980s, they developed what we call today the halogenerator, the machine that grinds the pharmaceutical salt.
okay.
In Europe and in many countries, halotherapy is very popular. It's being used in clinical, it's being used in many standalone spa, to the point that most government insurance in other country actually approve the
Yeah,
modality of halotherapy.
yeah. There are a lot of things in other country where the therapies brought into medicine, like you are. They kind of merge them, which is
It's
this is such a wonderful thing. So you basically now you got in touch with people who work within this association, and then your wonderful husband, who's also a
He
nurse
built it.
as well too.
I designed the room and he built it. We were looking for lease and what's not, and we decided that home was the best place to be, because the area, and we have the premises are very relaxing, and I wanted to provide, beside the medical benefits, complementary, because this is a complementary modality to complement any other treatment that they're doing with their medical doctors. We're not diagnosing here, or we are not calling medical shots.
Right, right.
Well, we are doing a holistic complementary modality, which I also include all the modality like Reiki energy, sound bath meditations,
Oh wow.
and how I came to it. As I find out, looking for what will help me for my sinuses, I was severe. I was very sick with my sinuses. It was bad. It was bad. I started researching what can I do besides the Flonase, because the Flonase wasn't working well. I came across halotherapy. Going to halotherapy, seeing the benefit for myself, and having the background as a respiratory therapist. Now I am over 20 years of experience in respiratory care practitioner. I decided every time I went to the room, one day I need to do this for people. Now I'll be able to help them before they really get this bad, because when they come to me in the hospital, there's a problem.
Right.
They are in trouble. They are in trouble when we get them in the hospital. So
Right.
I wanted to do it in a preventative way, in a way that beside the halotherapy, I can also provide an experience to relax, to be mindful.
Right.
I started researching, and I came to Soul Chamber. Soul Chamber Inc. is a leading facility in the soul therapy industry in Florida, out of Boca Raton, Florida. I look around and I study few, and I come across to them. I contacted them, and they guide me, and they are my providers. They are my providers of all my salt. My salt came from the mines in Pakistan, the Himalayan salt. What you see in the room is all Himalayan salt. I have 5,011 pounds of Himalayan salt in a 160 square footage room.
Wow.
And my poor husband put it all in by himself. It took 14 weeks for the salt to come across the ocean from Pakistan to Florida.
So
Then
it goes from Pakistan to Florida.
And in Florida, then 4.5 weeks. So Chamber put it together, all my things, and then delivered it to me, and my husband built it.
Wow. I just want to back you up. You made a good point earlier that you said that when you're in the hospital as well, too, you're there as the authority. You're stepping in, you're making sure people are not, they have a better outcome as far as
we are making decisions. Yes.
Right. You're a decision maker. But when people are, and this is a wonderful point, people are making the decision to come here. It's their decision for a healthy decision, a healthy choice. And like you said, it's wonderful because people who are coming to you, you say you're seeing responses, you're seeing wonderful,
very much.
But not only when they come to see you, you have a beautiful farm you're on too. You have a farm. Yeah, you didn't.
Yes, we do.
You're coming to an experience, a full experience. All right.
They mingle with the ducks. They see the ducks out there. They relax. Some of them said, I don't want to leave. Can you adopt me? And I said, no problem. Sometimes I tell the ladies, you can have a slumber party. We have things you can just, I love it. I love it. And people are looking for that now, actually. Wow. They're getting more in touch with nature, more in touch with the nature of it,
Sure.
Alternative, the natural way.
Yes, yes. I mean, Western and Eastern medicine as well too. We're looking in those areas, and I just find it wonderful that you're doing this. Now, you mentioned also you do sound therapy, a form of sound therapy.
Yes, look, this is one of my balls.
And now, what is this called? Oh, okay.
Yeah, this is one of my balls.
Can you explain to me what the bowl is, or what, obviously besides eating, you don't want to eat out of that bowl, but you want.
This is an Indian aluminum foil. Well, for centuries, thousands of years actually, in the Eastern culture, sound therapy is very important. They used to take the pots and pans from the kitchen and work it out because the resonance and the tunes really in tune yourself and activates your brain waves.
Okay.
So I do two types of sound therapy. I do the sound bath, which is playing all the balls. I actually set up by the beach and the soul room, and I have 45 minutes of playing the ball. Everybody is relaxed. I give them eye pillow. We do a little meditation, and I bring them to some people having a sleep in days, weeks, and they fall asleep within 10 minutes of me playing the ball. I have crystal balls.
Oh my.
These are very grounding.
So
this one, they actually tune to the frequency notes with the musical notes, with the energy points in the body. This one is the F note and is connected to the heart.
Interesting. Very interesting. I mean, being a musician, I find it very interesting too that you're tapping. So
Yeah,
the sound therapy. So I see you're pulling all different bowls. How many bowls do you have?
they different. So they're different. These ones are therapeutic balls. You can probably feel the vibration. This one goes on the top of the body.
So you actually put the bowl on somebody.
On the body, yes. Sometimes they have two balls in the body. You hear that? So this one works a little different. You can use it in the sound bath meditation also, but
Mhm.
they don't sing. Those ones are vibrational. They are therapeutic ball made of 7 metals. So how that one works is I do 30 minutes on the front of the body and 30 minutes in the back, and the balls go from the tailbone all the way to the shoulder blade. It start here by the shoulder, by
Mhm.
the heart, and by the pelvis.
Okay.
And it's 2 minutes on every position for 1 hour. How it works is the resonance travel to your body. We are mainly water. It creates some sort of kind of ripple effect,
Okay.
and it affects in a good way to the lymphatic system. It's very good for the lymphatic system. It helps you boil.
Okay.
Some people go use to the bathroom, urinate because it's boiling water that you have in the body. It helps with that.
You do this while they're in the salt therapies too? In this.
I have another small room that is I call it the energy room, where I do Reiki therapy, which is the channeling of the energy, the calming of the energy.
Wow.
Reiki is also being, yeah. Then in there I do the vibrational sound therapy, because that one is 1-to-1. Everybody's clothed. No one is naked here.
Okay. Okay. Good to know.
Yes, everybody's clothed, and the balls get on the body, and I'm striking the ball. I am certified vibrational sound therapy. I took the course with the Vibrational Sound Therapy Association. I am also a certified halo therapist, which I did it with the Soul Therapy Association also. I like to learn, improve, and find the innovation out there so I can provide my guests with the best innovation and the better
That's amazing.
product.
Now, before you take us on a journey of your facility, I do want to bring up a point, and I know that you went through something a while ago. Myra, you had COVID, correct? And you had COVID-19. And when I look back, you had a very compelling journey, because you had documented your journey with your camera, and the fact that you had all these skills that you attained prior to having COVID,
Yeah.
with the salt, the sound therapy. It was so compelling that even PBS reached out to you and did a covered your story. And in a short, small, can you tell us, having COVID, we know how terrible it is, and we know what
Yes.
we've seen it to
And
people.
the repercussion.
And I've been through the same journey, but I didn't have that holistic end, but I had the breathing techniques and things.
I can.
What did you do for yourself? I mean, what was going, I mean, tell us just a little bit about your journey in this. And we're also going to put links to your spas and all these things, but also to this wonderful story that I'm telling you, you're such an inspiration. Going through
Thank you
that,
so much.
it's like,
It's quite a journey. It's been a journey, and it's still to this day. It forever changed me, and I think it changed me for the best. Actually, well, I wasn't practically in the middle of the pandemic, working as a respiratory therapist for frontliner. My husband too. He's also a nurse, so he was sick first, and last week of March, and I got it at the first week of April. I start uh, with a little bit of aching, some pain, some problems with the breathing, but almost immediately I got what it looks like an anaphylactic shock. I
hmm,
broke out on hives. I had like what it looked like chicken pox all over me. I, oh my goodness, he's doing construction.
that's
Can
okay.
you hear the
That's
noise?
okay. Yeah.
So yeah, So it hit me so bad, and I start, because I was one of the first. I got it at the beginning. I want to make it a journey. I want to make it that people can see what it was. So I documented everything every day from day one. If I hadn't been a respiratory therapist, and if I hadn't had the soul therapy right here at home, which was a blessing,
Right.
and all my tools, what I call, I'm not sure I would have made it. It was very, very strenuous. It
Because
was
I remember,
hard.
I mean, there's a part of you, I saw that when you were going through this process of having COVID. I mean, you had that you said the inflammation response. Obviously, we know COVID is a respiratory virus. It attacks our respiratory system, and it affects people in many ways. As we know, we're in the collection phase of what happens to when you get this disease, and it's affecting so many people in so many different ways. But for you, when you had it, you said you had it in your sinuses. You were running. You were coughing. I could, I could see that you were struggling with your breathing.
My lungs
You
were
did,
shut.
right, your lungs, you did it
I couldn't breathe. My
right,
lungs were doing this. So I actually used meditation in order to guide my breath. And this is what I was on. I actually put myself on. And asked the doctors what I thought that was going to work for me, and they did it. I call it a miracle cocktail. I was doing halotherapy twice a day, sometimes only 30 minutes, because even that I had to get out and run to take a nebulizer. I was taking albuterol aerosol treatment every 2 hours, Benadryl once to 3 times, 2 to 3 times a day, because I was all
sure,
like I was having inflammation in my
yeah,
throat, itchy all over. I was taking hydroxychloroquine with a sit pack, and I was taking load up more on vitamin D, zinc, and C.
yes.
I was also doing steam because COVID dries you tremendously. The upper airway, bone dry.
Well, a lot
So
of
I
times,
was,
were you air hungry? In other words, when we're air hungry, we're breathing a lot. Were you breathing rapidly? Was your
I couldn't breathe. I couldn't even talk 3 words. I couldn't hold my breath for 5 seconds. I couldn't breathe. I was just literally like that. It was, I couldn't.
That's funny because I teach a lot of people when we talk about breath hold. That's one of our
Yes. Can you
benchmarks.
hear?
When we see the breath hold, that's a lot of times that I kind of use that as a benchmark or the baseline for people who we want to keep an
Yeah.
eye on it. But it's a very, very, very good observation. You're absolutely correct. Yeah.
So I documented it, and PBS 69 News, the local PBS here, got a hold of the video I had put out, and they seemed that was compelling to put it out so people can see how it is and how I was treating myself. But it worked for me. That it might not work for anybody, but at least they have an idea. I started it. My platform for the video was on YouTube. YouTube removed the video because they thought it was too harsh.
Okay. Well, because it was very difficult for young people to see. You
To
mean
see, it was very harsh,
right?
and it take a toll mindly too, mentally.
It could be
I,
scary. You know
I
what I
was
mean?
in a
Some
roller
people,
coaster
yeah.
emotionally.
Right. Sure. Sure. I mean, it's understandable. I mean, it's such an emotional and such physical thing that it's traumatic to see. I mean,
I'm sorry for the noise.
no,
Should I just go and tell him?
no, I hear nothing. So
Okay.
it's a great you have your headset on, so you're good. You're good.
All right.
But you were like you were saying though. So they got a hold of you. They interviewed you, correct?
Yes, they did. They came here, but because of nobody was. We had to keep isolation. He made the reporter from there, and then he took the parts from our interview that we did over Zoom, from my video, some of my video that I have put on. And it helped. Some people actually contacted me, and I have many people asking me questions, how I was doing, how did I do when I did this, did it work? The soul therapy, immediately, almost within 15 minutes in the soul room, My nose started running because it was dry. So it gave me moist. My nose started running. It's much better. I could breathe a little easy. And I was just combining everything. I hit it with everything I got to the point that there was a point that I was breathing with my mind, literally almost.
Right.
I was doing meditation. I'm a meditator. Wake up at 4 o'clock every morning to meditate. I'm almost on my 1,000 days straight.
All right. Look at you, 1,000 days straight. That's
Yeah,
inspiration.
very close to 1,000 days straight. So I used to put my mind, imagine bringing my breath to my crown chakra
Mhm.
and sending it to the heart,
Yes.
slowly and deep and slowly as I could. And from the heart directly into my lungs, because my lungs were not taking in the breath.
Mhm.
Well, I was thinking to myself, what can I do with this set of lungs if I'm at the hospital treating this set of lungs, which I have before? There's nothing I can do other than maybe put a little bit of pressure. So I was trying to give myself a little bit of auto PEEP, but it was very hard for me because the lungs were so rigid
Explain
that
to
I
people what
couldn't maintain it inflated.
auto PEEP is just a way of keeping your airway open. Just for the
Open
people
up.
who don't have
Yes, so people
this
understand.
language base. Yeah. So
Yes,
that's
sorry.
why we're doing a lot of breathing techniques. We try to breathe so it's light.
I was breathing like a little fish, like taking the little breath slow and kind of with my mind and hold it the best I could because I couldn't. It was such a struggle that I used my abdominal muscles and my thoracic muscles, my chest muscles to breathe and my breathing muscle so harsh and so much that it was in April that I was sick. And it's still in September, I was feeling pain on my abdominal muscles and my chest muscles from pulling so hard to breathe.
Sure. It's
It was
very
traumatic. It's traumatic too.
Let me ask you a question. What kind of, when you had this, what was your nutrition like? What were you eating?
I couldn't eat nothing at all for the first 16 days. What I was doing is I was taking electrolytes,
Okay.
liquid, because every time, even if I try just to bring my hands up, it was an effort. I couldn't be just if I got a little bit my 10% better. I say, oh, let me see, maybe I can try to eat this banana or something like that into the fruit, or maybe have some raspberry. I couldn't just to lift. Then I got an exacerbation, and I had to run and take my breathing treatment, go to the storeroom. Okay, I couldn't sleep neither. I was having asthma attack. The glottis, the throat used to be tight. I used to have.
Do you have asthma?
Laryngospasm, yes, due to allergy. That
So you have,
exacerbates
okay,
tremendously.
right. So now that and just now that you said you have asthma and you have allergies, do you find with your salt therapy now that has obviously we never get rid of asthma. It's a gift
No,
away, but it's in control now.
90% manageable. 90% manageable. And I was 100% before COVID. I haven't used my inhalers in forever before COVID.
Yeah.
No itches on my skin or nothing. I'm very allergenic to a lot of things, medicines, food, the environment, and that's what provoked my asthma. But having the salt therapy here, at least twice a week, I have it done. Unless I'm feeling like I need it more, then I do it more often. I have it at home. Sometimes in the middle of the night, if I feel like I can breathe, I just get up there, gear up for the storeroom and do it there. It's helping me a lot.
Well, not everybody has a salt spa, but you did mention something to me on a phone call that we had that there are home people who can't make their way to a spa, people who can't leave their homes, people who are in part of the countries.
Soul Chamber came out with there's other one there, but Soul Chamber came in with a fantastic home-based portable halo generator. That's the name of the machine that grinds and produces the aerosol or aerosolized dry salt.
Okay.
And they call it Halo Home, something like that. It's in the Soul Chamber, and it looks like a mug. And they have set for, I believe it's 6 or 10 modality. And you can do portable at home. You can take it with you and you can have it, use salt therapy. But the most important thing is that it is pharmaceutical salt where you breathe. That's what give you the actual therapy.
Right, right. So do you have, with the small one, do you have to be in a smaller contained area? So this,
Yes.
so
In a pot, like in a tent that look like a pot, they call it the weather pot. You
so
can actually do that, or stay in a room in a little corner, you by yourself, closer to you where you can breathe it.
Okay. And very, very nice. So
I'm
now,
actually going to take that or working on that concept to do cats and dogs, because it's actually soul therapy is very good as well as for humans. It's very good for cats and dogs,
that
for
was my
pets.
next question. I saw that you had something on your website, which we're going to post about pets,
Yes.
pets who have allergies. Believe I have a dog that has an allergy, and we're giving it, but that's so
All
tell,
they need is 10 minutes. All they need is 10 minutes, less than 15 minutes. I will say 10 minutes with the halotherapy. There's a great doctor in Florida. She has a great office that she treats equine. Is for horses. It's absolutely amazing, to the point that Thoroughbred use and polo horses, Thoroughbred and polo horses, they use halotherapy.
interesting.
Some some Canadian champions and US champion have used halotherapy for horses, the equine.
Very
It's
good.
very interesting.
So being that said, are you going to take us on a journey throughout
Yes,
your
we can
spa
go.
experience? Now, I know you're on a cell, and I know there are people who are just listening to this, and there's some people who are watching. So maybe you can give me a little
Yes.
description as you're
So
going
if you
along.
come with me, I'm gonna take you to the soul room.
Okay.
I'm gonna take you where everything takes place first, which is the halo generator. Bear with me. So
Okay.
this is my halo generator. This is the machine that grinds it. It's always locked. Everything is very controlled, it's sterile. It's always locked. So I show you what looks inside. Inside, the soul goes through here.
Okay.
The soul is heated. It goes through there, and it get grinds in there, and it comes through the tube in there,
So you describe, it looks like
and it
a big
disperses
funnel.
into the room.
A
With
big,
this fan is blowing inside the room.
very nice. So it funnels down. For those who can't see this right now, it funnels
Yeah,
down, goes into
yeah,
the,
it funnels down. It funnels down from here, works it. From here is the grinder, and it pushes back in. The fan blow it to a control, a stainless steel, and a pipe that goes straight into the soul room, which you're gonna see the other end when I take you
Okay.
to the room.
Very good.
And I use pharmaceutical soap. It's
Okay.
pharmaceutical soap approved by the US Pharmacopoeia. So relaxing here. So this is the soul room.
Oh, how nice. How beautiful.
Yeah, so this is the
Yeah.
soul room. This is where it comes. Let me take my shoes off, because over here, no shoes, it's barefoot, and no barefoot and no shoes. So it comes from there. If you see the pipe there,
Right. So
that's
there's
where the
pipe
soul
that comes.
comes.
So kind of what we're seeing is you're going in, you have rock salt, looks like it's on the wall a little bit.
Yeah, those are the soul that came from Pakistan, and on the floor too. See, on the floor, they work on soul.
Oh, so there's salt on the floor, there's salt on the walls.
Yeah. Remember, the Himalayan salt contain 84 minerals that are in our body. And when you in here, this on the wall and the decor, it does nothing but relaxing.
Mhm.
It's for the concept of decoration and relaxing, with the lighting and the heater in the light, with the lights.
Is there
People
humidity
breathe.
is there humidity in the room? Like if you walk in, is there a heavy humidity? Is there no humidity? How is the
As the humidity is controlled to be less than 45,
45%?
and the temperature is keep always cool
Oh,
also,
okay. I see
because
that,
of the soul. Yes.
right.
And it's a beach theme, so they are in the beach. People sit here and they pretend they're in the beach.
What a beautiful,
And I play binaural music, and you can hear it,
lightly,
and the ocean.
but
So
so you have music playing in the background, you have a beach theme. Wow, this is it. What an experience for people to come in. I never knew it was so So,
Yes.
and how do you clean a room like that? Like, do you clean it? Like once people
Oh,
get in there?
yes. Actually, there's an exhaust HVAC system in here. It's an exhaust that immediately after the halo generator turns off, the
Mhm.
exhaust goes on and it extracts all the salt that's in the air and anything that's in there. This is a very controlled, clean, sterile room. And the salt, the chairs are waterproof. They pull chairs actually,
Oh,
and I wipe them. I wipe them with the antivirus wiped. I have a floor lamp UV light actually that I use, and the salt here get raked and torn
oh,
over.
okay.
We also use a vacuum cleaner. I use a vacuum cleaner with a mesh on it to go around and take the salt and the mesh from here too and pick up anything that is in there. And this is part of the system that's in the ground, because when the halo generator disperses the salt from here, it's like it look like a fog a little bit. Some people cannot see it much, but
Right.
it's there. You can feel it in your lips because it lands in your lips. It's in your skin, and people think it's on the beach. They fall asleep in there. And then,
I'm,
knock knock, you got salted. They're like, oh, I don't want to get out.
I'm gonna make my visit out to Pennsylvania. Go ahead.
I will be thrilled to see you here. It'll be an honor.
Yes, my
So
so now you have so that's the experience. That's so beautiful. Now you're
yeah.
going back to your office. You have another
Yeah,
room.
this one is the one that I'm working on something here. You see all of these pyramids? I'm working on something. I know something new that I'm gonna do. So this here is the my Reiki room, my energy room. This is what I do with the ball. You see the balls?
Yes.
Two on the bodies, and so yeah, this is my room. And
My God, beautiful, Myra. This is a wonderful facility. I wasn't aware that.
thank you.
Oh, yeah, what a beautiful job
Yeah,
you've done.
there you go. So-called wellness.
My gosh. Well,
Yes.
I'm definitely going to have to make a visit out there for sure, without a doubt.
We need to, yes, we need to talk in here, and you can experience it. And I'm very happy with the turnout, and I enjoy it so much. I think I enjoy more than the people when they come here, just to see them, their reaction, and when they come out of the room. Sometimes I have people come out and they're like, "I can breathe better. My nose is clear." And just and
That-
then the relaxation and the tea and enjoying the whole ambience. I'm loving it.
the
I'm
whole
really
experience.
loving
Oh
it.
my God. Wow. I'll tell you, this is wonderful. I'm definitely going to make a trip out there to visit
Awesome.
you,
Let me know.
and I'm going to and visit Jude as well too. And I want to thank you so much for taking the time for being here with me
You're
today,
welcome.
and bringing us into your spa and into your home and into your story of what you've been through. And you and I also do share our experience and education together. We did go to school
Yes.
point together.
We
And
went to our respiratory college
yes,
together, and it was amazing. We did clinicals together, the residents
right.
together.
And you had so much energy then, and I'm glad you were able to funnel all your energy that you have into such a wonderful thing. And
I have a passion. I want to get ahead, and I have a vision for so-called wellness, and I want to expand. I want to do things. I want to make it a place that people feel safe, that when they think there's no escape from anything, they can just come to so-called wellness and spend a moment with themselves. And
sure, sure. And I like what you're saying with the home thing too, that the whole wellness, bringing together the whole person, the whole body, that people who feel they're hopeless have hope, people who there's always a positive answer, a positive energy flow. I just love everything you're doing there, Mara. And I want to thank you again, and I want to have you back again. And
yes,
I want to have you back on Bloom Health here, and I want you to join us as much as you can. And I
thank
wish
you.
you all the success in everything that you're doing, and I appreciate you so much.
Thank you, Stephen. It's been a pleasure. Thank you so much. I
And
love what you're doing. Your platform is terrific.
oh,
I've
thank
been
you.
paying attention to.
Yeah, and I'm gonna bring in. We always say, it's always one breath, one step at a time for good health, and I
That's
wish
it.
you that one step
Thank you.
One breath.
Thank you so much.
So have a wonderful day. Thank
You
you.
too.
And we'll be in touch. And I'm going to put
Breathe easy and stay salty.
Stay salty. I'm going to put all your information for everybody to say.
Thank you.
Thank you. So long. Bye-bye.
Bye-bye, everybody.